How can an athlete who is so physically fit and in tune with their body suffer from a sudden DVT or PE?
Well, it's actually very counterintuitive. You think of these athletes as very young, very healthy individuals, and you associate blood clots with older age and have an incredible number of medical comorbidities. But actually, when you think about it, these athletes push their bodies to such a high level and so frequently are injured, sometimes severely with fractures, sprains, knee injuries, that they're put on bed rest or told to be relatively immobile. They're casted or put into braces, and they often have incredible amounts of inflammation associated with the injury, that it's not surprising that they would develop blood clot in the legs or deep vein thrombosis. And we know that deep vein thrombosis in certain situations can break off, travel through the right heart into the lungs, and form a pulmonary embolism. So when you really think about it, it's not that surprising.
Could you talk about some of the other risk factors for DVT or PE that are specific to athletes?
Sure. Like I mentioned, just soft tissue injuries or even more severe injuries such as fractures introduce an incredible level of inflammation both locally and sometimes systemically throughout the body. And we know that inflammation actually begets thrombosis or blood clots. On top of that, these patients are limited in their mobility and many times have to be put into a boot or an air cast or a brace, and that limits mobility and encourages the formation of blood clots. Now, there are other things that may not be specifically related to athletes but are associated with young people that can also predispose to blood clots. You may have remembered Serena Williams, the tennis star, suffered a pulmonary embolism. In female athletes, the use of oral contraceptive pills could also augment the risk of blood clots in the setting of an injury, and so that's always important to keep in mind.
What sort of signs and symptoms should people look out for with DVT and PE?
Well, hopefully there will be signs and symptoms. Unfortunately for one of these stars, the presentation was actually a fatal pulmonary embolism. For Chris Bosch, the presentation was one of back pain, chest pain. Those are symptoms to keep in mind for pulmonary embolism. Other things could be shortness of breath, lightheadedness, palpitations. For deep vein thrombosis, patients often complain of swelling of the legs, pain of the legs, redness, difficulty walking. And I think keeping in mind symptoms that are persistent and unusual will help to keep athletes and their trainers thinking about blood clots.
Is there an important lesson that people should take away from these tragic events?
I think there is. I think that it's important to keep in mind that blood clots are not a disease of the old and the sick. They can be a disease of the young and the very healthy, and we need to always keep blood clots at the forefront of our mind when patients present with symptoms that could be attributable to them.